Assalamualaikum warahmatullahi wabarakatuh. My name is Alfarisma Regita Arliantari. I am from the S1 Nursing Study Program C. In this video, I will describe about tuberculosis disease. Diseases are certain abnormal conditions that negatively affect the structure or function of parts or all of the body of a living being, and are not the results of any external injury. Diseases are also known as medical conditions that are associated with certain clinical signs and symptoms. As I said earlier here, I will discuss about tuberculosis. Tuberculosis, TB, also known as TB, is a lung disease caused by the bacteria Mycobacterium tuberculosis. TBC will cause symptoms in the form of a choke that lasts a long time, more than 3 weeks, usually with phlegm and sometimes bleeding. TBC can not only attack the lungs, but can also attack the bones, intestines, or glands. This disease is transmitted from the saliva that comes out of TBC sufferer when talking, cooking, or sneaking. This disease is more susceptible to infection in someone with low immunity, for example, people with HIV. There are two types or grades of TB. Number 1, latent TB. This is the inactive form of the disease because the body's immune system can fight the TB bacteria. People with latent TB will have no complaints as long as the disease is not active. Latent TB is not contagious. Number 2, active TB. Active TB occurs when bacteria begin to win the fight against the body defense system and start causing symptoms when bacteria infects the lungs. Active TB can easily spread to other people. TB can also be classified based on the location of the infection sites. Number 1, pulmonary TB. This is when bacteria are found in the lungs. This means that there is a danger of passing the disease on to other people every time the infected person exhales, coughs, and laughs. Number 2, extrapulmonary TB. If the bacteria grow only in the other parts of the body and not in the lungs, the disease will not spread as easily as in the case of the lungs. Cause of tuberculosis. The cause of tuberculosis is bacteria that are spared in the air through the saliva from cooking or sneezing with TB. The name of the bacteria is Mycobacterium tuberculosis. Here are some groups of people who have a higher risk of contracting TB. Number 1, people whose immune system has decreased. For example, people with diabetes, people on chemotherapy course, or people with HIV or AIDS. Number 2, people who are malnourished. Number 3, drugs addicts. Number 4, smokers. Number 5, medical officers who often come into contact with people with TB. Symptoms of tuberculosis. Tuberculosis generally attacks the lungs with the main symptoms of a choke with phlegm that lasts more than 2 weeks or 3 weeks. The cough that occurs also sometimes products rash color or cough of blood. People with TB also usually lose their appetite and experience weight loss, accompanied by fever, neck sweats, and fatigue. It is the tuberculosis infection of the lungs has caused damage to the lungs. Symptoms of shortness of breath will develop. TB bacteria may be inactive when they enter the body, but over time eventually cause TB symptoms to appear. In the case, the condition is known as latent tuberculosis. Meanwhile, TB that immediately triggers symptoms is known as active tuberculosis. Tuberculosis treatment. TB can be detected through sputum examination. Some other tests that can be done to detect the infectious disease case, X-ray, blood test, or skin test. TB can be cured if the sufferer adheres to taking the medicine according to the doctor's prescription. To overcome the disease, sufferers need to take several types of medicines for a long time, at least 6 months. The drug is generally in the form of isoniazid, rifampicin, pyrazinamide, and ethambutol. As a types of the therapy used the treatment of tuberculosis. A therapy for active TB consists of number 1. Combination treatment. The use of a variety of drugs to ensure that bacteria do not become resistant to the antibiotic being consumed. This therapy usually involves 4 kinds of antibacterial drugs that are taken continuously for 2 months to 4 months. Number 2. Direct absorption therapy, DOT. In this case of DOT, patients are closely monitored by an attending doctor whenever they take medication. B. Latent TB therapies. Number 1. Antibiotics. People with latent TB need only 1 tip of antibiotic at a time. Antibiotics that are usually prescribed include isoniazid 6 to 9 months and rifampicin 4 months. Number 2. Combined therapy. For latent TB, at the most 2 types of drugs can be taken at the same time. Direct supervision medicines may also be used. Tuberculosis prevention. TB can be prevented by giving the vaccine, which is recommended before the baby is 2 months old. In addition, prevention can also be done by number 1. Wear a mask when in a crowded place. Number 2. Cover your mouth when you sneeze, cough, and laugh. Number 3. Do not spit or spit carelessly. So my explanation about tuberculosis. Apologize if there are deficiencies or mistakes in making this video. Thank you for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.